Hello everyone. Thank you for joining our webinar, Rewarding Success, Providing Incentives with Certification Programs. This webinar is the third in a series we've been calling New Carrots on the Block. And today's webinar will focus on how to develop a healthy corner store certification program. We're going to draw on content from our first two webinars, which covered in more detail the types of partnership and funding needed to support this work. And if you weren't able to join us for those two webinars, you can download and listen to all of our webinars at our website, www.changelabsolutions.org. So for today, most of you who are joining the call know that corner stores and convenience stores, gas stations are really a common part of the retail landscape. They can be places to get a snack or pick up basic household supplies, maybe get some gas. And they may also be places that provide access to tobacco and alcohol, which can be concerned for communities with many young people. And if the stores fall into disrepair or attract vandalism, they can be contributors to blight. So that's really the challenge. These stores can be seen as nuisances, or they can be seen as potential contributors to health, community health and neighborhood vitality. And I'm guessing that you've joined the call today because you really see the potential. So we're seeing communities around the country working with stores in many, many different ways. And for today, we're going to focus on one particular strategy, healthy corner store certification. So what do we mean by that? Well, healthy small store certification programs are fairly structured. Typically, food retailers apply to the program, they agree to meet defined standards, and then in exchange, they get benefits, including free publicity and help implementing the healthy changes. So certification is really a formal agreement between the store owner and the organization or the agency running the program, and typically includes some degree of monitoring of the store owner's compliance with the standards. So that is it's basically a structured way for community-based organizations and government agencies to give incentives to food retailers who are willing to sell healthy foods. So today's webinar is going to describe the basic components of an effective corner store certification program, and we'll cover key considerations for implementing, enforcing, and sustaining your program. We're going to hear today from two of the leading practitioners involved with healthy corner store certification from Omaha, Nebraska and Louisville, Kentucky. And throughout the webinar, we hope that you will chime in with your experience using the chat function to share experiences from your community and ask your questions. Today's webinar is being brought to you by my organization, Change Lab Solutions. We're formerly known as Public Health Law and Policy, and we use law and policy strategies to create healthy communities nationwide. And we're one of the co-sponsors of the Healthy Corner Stores Networks, which supports healthy corner store projects all across the country. And our webinar is sponsored by the Network for a Healthy California, and the network's retail program provides really fantastic support to neighborhood stores to inspire healthy change among consumers, and really encourage everyone to check out their resources. They're very, very useful. And just so you can put a face with my voice, I'm Hannah Burton-Lorison, and I'm trained as a planner with a focus on healthy food access strategies. And I live around the corner from a liquor store that has lots and lots of challenges. So I get to experience in my community every day some of the real-life implications of the work that we're going to be talking about today. I'm joined by my colleague Lisa Chen, who is a planner with a strong interest in sustainable, healthy communities. And I happen to know that Lisa lives around the corner from a really fantastic corner store that offers lots of fresh fruits and vegetables. So we have here in Oakland two examples of maybe what it shouldn't be and what it can be. And I would imagine that's probably true in your communities too. There are probably some really strong examples that we could all be learning from. We're joined today by, as I said, by two leaders in the Healthy Corner Store movement who will share lessons learned from implementing Healthy Corner Store certification programs in their communities. Sarah Schramm is the Community Transformation Grant Program Manager and the Healthy Neighborhood Store Project Coordinator at the Douglas County Health Department in Omaha, Nebraska. And she is joined by Sasha Belensky, who worked under the Communities Putting Prevention to Work grant at the YMCA as the Food Access Project Manager, and she manages the Healthy in a Hurry Corner Store Initiative as a part of that grant. She's now the Interim Director of Healthy Actions for the YMCA of Greater Louisville. So I just want to make sure that you're oriented to a couple of the technological features of this webinar. The chat box appears on the lower left-hand side of your screen, and you can use that to share questions, to ask questions or share your experiences, and we will be responding to them throughout the webinar, as well as at a question and answer period at the end. We'd also like to know a little bit more about you, those of you on the call. On the next slide, we're going to ask you to select the response that resonates with what's happening in your community. So we'd like to know, what's your current involvement in Healthy Corner Store certification programs? Are you just starting out and looking for ideas? Are you beginning to plan your program? Or are you already implementing or operating an established program? Seeing lots of responses coming in. It looks like many of you are just starting out, which is really perfect. I'm also really pleased that we have several of you who are already planning and implementing. So we hope that you'll really talk back to us and share your experiences to concur or disagree with whatever we're saying on the call today. So a strong, healthy Corner Store certification program, as we're defining it today, requires participating stores to increase the variety of healthy foods they sell. It requires them to reduce the offerings of unhealthy foods and to proactively market healthy options. And in exchange for that, stores that join the program receive incentives developed by the sponsoring organization or agency. So the program really requires a commitment from both the sponsoring agency and by the store operator. So what do Healthy Corner Store certification programs look like? We did a survey of currently operating and programs that had existed in the past, and we saw a lot of variation in how communities had structured their certification program. We talked to folks in New York City, we talked to folks in the Navajo Nation, in Kentucky and Nebraska, San Francisco, Philadelphia, really very diverse sorts of communities. And there isn't a single definition of what a Healthy Corner Store certification is or what it looks like around the country, but we saw some common characteristics. Typically, Healthy Corner Store certification programs are administered by the health department or by a community-based organization. Where a community-based organization is the lead, they typically have very strong local government partnerships, and we'll talk more about that in just a moment. As I said, the stores enroll in the program and agree to meet defined standards. We saw a lot of variability in how formal the agreement was, and we're going to share some recommendations about best practices for that agreement. But it currently, I would say, it ranges from very formal agreements to highly informal collaboration. The stores receive various incentives. We'll go into some detail about what those can be and how you can pay for them. But one of the main ones is clearly publicity. It's really branding the store and giving them lots and lots of recognition for what they do. And I think that's actually one of the most valuable incentives that you can offer stores. And then I would say finally the characteristic of a really good Healthy Corner Store certification program is some degree of ongoing monitoring and enforcement to make sure that the store owner continues to perform in the way that he or she has agreed to do so. So how do you know when a Healthy Corner Store certification program is right for your community? There obviously are lots and lots of different strategies available to improve the food environment. How do you know what's right? What we saw is that many Healthy Corner Store certification programs came out of community food assessments where folks had looked at how the community gets its food, sometimes going all the way to understanding from farm to fork, including production and processing, distribution, consumption and waste disposal. But in other places, communities have conducted much more focused assessments to understand the food retail environment, and that can be very, very helpful. Really, I think regardless of the scope of the assessment, one of the really defining features, I think, of successful assessments is the degree to which community members are engaged in, if not actually leading the process, to really make sure that the dots are connected so that the results reflect the true needs and desires of the community. So I would imagine that many of you probably already have done some mapping of your community, and we'll talk about that process in a little bit more later in the webinar. But I think once you have a clear picture of the opportunities and challenges, the next step is really deciding, well, what do you do with that? And many of you will probably work on a lot of different strategies. A healthy food retailer program for some communities is seen as a shorter-term strategy. We're going to work with small stores while we also work towards full-service grocery stores. And in other communities, I think it's really seen as working with small stores is a core part of our food access strategy. We really see these small businesses as a permanent part of our community that are going to be that ideally will be offering healthy options. From our perspective, healthy corner store certification programs tend to work best in communities that have lots of small stores. You're really creating an identity for the idea of a healthy store, so having plenty of stores is probably valuable. It works best in communities that have identified the resources. And if you're on the call today saying, but I don't know what the resources are in my community, that you're in the right place, and we're going to help you figure out how you conduct that treasure hunt to find out where those resources are. And I think the third characteristic is really having strong working relationships between the government and community organizations. That bridging function, helping to connect those three partners, local government, community organizations, and retailers, is really at the core of how most healthy corner store retailer programs are structured. So I'm pleased to announce that we will be releasing a toolkit on developing healthy small store retailer certification programs this fall. And the toolkit will go into a lot more detail about how to plan for your certification program. And all of you participating on the webinar today will receive an email as soon as the toolkit is released. So let's break it down. How do you get started? We're going to go through now each of the steps involved in setting up a program. Now keep in mind, of course, these stages can overlap, and you can expect lots of variation depending upon what's happening in your community. But clearly, as I said earlier, most programs do start with some form of assessment and scoping. So we're going to hear from Lisa now about what that looks like in practice. Lisa?
Thank you, Hannah. As Hannah has already mentioned, you may already be in the process of doing assessment as part of some larger process or food access strategy. And so we just wanted to highlight a few considerations that you might want to think about for assessment for healthy corner store certification programs. For those of you who are still in the process of planning what this assessment will be, this is really a good opportunity for you to start to think about what stores might be good to target, your existing needs and opportunities, and developing an overall scope for your program design. These early stages are pretty crucial for helping you design a program that appropriately addresses the challenges in your food retail environment, and is a great opportunity to involve stakeholders who can provide support for the duration of the project and beyond. Ideally, you will structure your assessment so that the research questions and results can help you shape your program design. So here are some of the basics that you will want to cover in your program as you flesh out the scope. If you haven't already, you'll need to think about the geographic scope of your program, whether you're targeting the whole city or a few key neighborhoods, and what your particular population is that you wish to target. During the assessment phase, you could analyze GIS mapping and health data and talk with key stakeholders in order to help you determine this. You'll also need to start thinking about the number and types of stores to work with, how extensive the store interventions will be, and the amount of staff and volunteer time needed. While some of these decisions may happen in the later stages of your work as you're starting to actually plan and implement the program, the assessment period can help you collect valuable data early on the store environment that can also help inform these decisions. There are a ton of different assessment tools out there, and so we just wanted to highlight a few to provide you with a starting point. At some point, you will probably want to do an assessment of what is happening in your local stores. The first two tools on this list, the CX3 survey instrument from the Network for a Healthy California and the Nutrition Environment Measurement Survey, or NEMS, from the University of Pennsylvania, are both very comprehensive and provide a detailed set of research questions that can help analyze an individual store to see whether it has healthy or unhealthy products, but also business practices. So for example, the CX3 survey includes questions on whether a store stocks produce and healthy staple foods, whether or not they have advertising for both healthy and unhealthy products, whether or not the store exterior is accessible and attractive, and whether or not the store participates in federal food programs such as SNAP and WIC. The Nutrition Environment Measurement Survey corner store instrument is currently being validated in Philadelphia corner stores. This is a version of a previous instrument that was more for the general food retail environment. And you can contact UPenn for more information and to see the actual survey. We also wanted to highlight the Healthy Corner Stores Network, which has a range of program materials, including some assessment tools from many different Healthy Corner Store programs around the country. You will also probably want to tailor whatever assessment you use to your existing resources and your time constraints. In addition to assessing your retail environment, you may also want to start thinking about including questions that can help you during the store selection and program design phases. For example, you could ask store owners whether or not they've ever tried stocking fresh fruits and vegetables in the past, as one potential indicator of their willingness to participate in your program later on. And we also wanted to just highlight one example of a community that had a particularly comprehensive assessment process. In Pitt County, North Carolina, their corner store initiative involved an assessment process by the health department, which partnered with the local planning department to map schools and housing developments, including low-income housing projects, in relation to existing food stores. Based on this data, they honed in on 11 corner stores that were located near underserved populations. These initial surveys with store owners and customers ultimately helped drive the store selection process later on. They ultimately selected 9 stores which stood out as having potential for successful participation based on store owner interest in the program, customer demand for healthy food, and current WIC and SNAP certification.
So cross-sector partnerships are really key to the success of any community food initiative. I'm not telling you anything you don't already know. But I think that for healthy food retailer certification programs, partnerships between government agencies and community-based organizations are especially important. I see them as serving really 3 main purposes. First of all, they encourage buy-in from community residents, businesses, and stakeholders, to get to that level of collaboration. Second, they really improve the chances for program success and acceptability because each brings its own unique strengths and potentially resources for establishing incentives. And third, they really enlarge the scope of resources and the expertise that's available. And that's something that is a theme that we heard again and again from around the country, is how much stronger the programs were with the right partners involved. So partners can include city and county government agencies and departments, in some instances state agencies and departments, local businesses or nonprofit organizations, community health partnerships, universities, store owner associations. And you can find a lot more information on each of these partners in the first webinar in the New Carrots on the Block series called Cultivating Relationships, which again is available on our website. But really, I would say that your most critical partners are the store owners and the staff, their managers. And I think that it can't be stressed enough how important it is to talk to the store owners really early in the process of thinking about your certification program. It's so critical for you to understand the challenges that the owners face in offering healthier foods and to help understand what are the incentives that might be attractive to them. And I think you really may be surprised at when you listen to store owners at the sorts of incentives that are the most valuable. I often hear from people that they're, we want to be able to give them these fairly large grants, and of course, free money is always good. I'm definitely not saying that a store owner would not be excited to receive free money from you. But I think that there are lots of in-kind incentives and promotion that you can do that actually may have more of a lasting impact than a one-time infusion of cash that you should really consider. I was really struck in a conversation with a store owner once who recalled in really great detail an event that had been held at his store, a nutrition education day, where a member of the board of supervisors had come to his store, and that had happened probably 6 or 7 years prior to the conversation that he and I were having. But he was remembering it with incredible emotion, and that had really been a turning point for him, and how he viewed his store and how the community viewed his store. And not that it's easy to pull off events with elected officials, but it may be more cost effective. So really listening to your store owners is so critical. And I think that outreach can happen ideally through one-on-one conversations, but I'd also encourage you to reach out to local business associations, particularly those of you in communities with large numbers of small food stores. There may be one or even more associations of store owners. And you can start perhaps with your local Chamber of Commerce to find out if such organizations exist. But once you know who the store owners are and you've had some conversations with them, how do you decide which corner store owners are good candidates for participating in a Healthy Corner Store certification program? And I would say that your community food assessment or your existing relationships or experience with store owners probably has given you a lot of insight into what will work for your community. But given the time-intensive nature of these programs, I think it's very important to pause at the point where you decide which store owners you want to participate, and really develop a focused recruitment strategy that has the greatest potential to impact community health. And I think that your strategy will be driven to a large extent by the resources that are available in your community to support stores, and the specific needs for healthy foods and other products that you see in your community. So we saw a lot of different criteria in the programs that we surveyed around the country. Some deliberately excluded chain stores. Some excluded single product stores like liquor stores or bakeries that really weren't going to be a full service small stores. Some developed criteria based on store size. Others looked at characteristics of the owner, like how long had they been in business, how connected were they to the community, what was their commitment to changing the business model. They looked at the availability of the capacity of other staff in the store, employees in the store, to support the program. Obviously, it's not just about the owner. They looked at the store's proximity to schools or health-oriented venues like community clinics. Many looked at compliance with WIC or SNAP retailer requirements. So there's a broad range of selection criteria, and different selection criteria will make sense for different communities. But I would say probably paramount for you is to not forget to discover what the community thinks of the store. In my experience, community residents often have a very, very strong relationship. Could be positive, could be negative, with store owners. And not to say that that opinion can't be changed in one direction or another, but store owners who are already viewed in a positive light may be a really excellent place for you to start. And I think it's worth the time to figure out who those stores are. We're going to hear in just a moment more about the Healthy Neighborhood Store program in Douglas County, Nebraska. But I wanted to highlight here the key role that community advocacy organizations played in the Douglas County Healthy Neighborhood Store program outreach efforts. The community organizations were involved in many, many different aspects of setting up the program, from running focus groups to coordinating outreach directly to the stores, and then again, as I said, really being a neighborhood liaison for the overall project so that residents were engaged. And that was so important. This corner store program came out of the health department, and working with community organizations was really critical for them to overcome language barriers and to ensure that the project really aligned with community needs and interests in Omaha's African American and Latino neighborhoods. So they were the health department was able to really effectively gather input on the kinds of foods residents wanted to see in their local stores and learn more about what they were already buying. So that information all really informed the way the healthy changes were implemented, and I think really built the foundation for the success of the participating stores. So that's a whirlwind, but once you've selected stores, I know many of you have questions on your mind about how do you identify the resources available to you to support the program and the incentives that you'd like to offer store owners. So let's hear a little more about that.
So during this process where you're trying to determine what the possible incentives that you have available are, these partners that you've developed and cultivated during this process are really going to be critical. As you're trying to build these relationships with diverse public, private, and nonprofit partners, you'll start to develop a better sense of what resources may be needed to support this program and who else you might need to do outreach with in order to get additional resources. Our previous webinar in this series, Green for Greens, discussed the process of seeking funding and other resources in depth. So we encourage you to visit our website to view that recording. But we're going to highlight just a few resources that certification programs in particular may need. Perhaps the most critical resource that these programs need is dedicated staff time to plan, implement, and oversee the program. From the interviews that we've conducted for our upcoming certification toolkit, we found that these programs do require a lot of staff resources. We found that it's pretty common to have about one full-time staff working with perhaps 10 to 20 individual stores. Of course, there is variation across the country, but that's a sort of ballpark number. Here is a list of some of the types of activities these program staff members may be involved with. Everything from program planning and evaluation, to fundraising, to store recruitment and inspections, to providing technical assistance. However, there are other resources that may be critical to the success of the project. Even if you find store owners who are on board with the idea of selling healthy food, they may lack the critical information and infrastructure to do so. For example, they may need improvements to the store in order to be able to store, stock, and market healthier options. These investments in the store infrastructure could range from very low-cost materials, such as display baskets and promotional materials, to more costly improvements such as updated refrigeration equipment. The stores will likely need technical assistance that may fall outside the expertise of your program staff. So having valuable skills such as store layout and merchandising and business planning may be needed to make the healthy changes part of a sustainable, profitable business model. This can help ensure that the changes remain after the project is completed. Finally, branding and publicity is a common thread across most of the programs that we've seen. Many programs have tried to create fun and attractive marketing materials and publicity campaigns that can communicate the healthy changes to the larger community. If you already have a defined source of funding that you think will be sufficient to carry out many of your main program activities, that's really great. Even so, you'll probably already be thinking about what resources can sustain your project in the future. Here are a couple funding guides that we recommend browsing through. The guide on the left is published by the Opportunity Finance Network, and on the right is a publication that Change Lab Solutions issued called Green for Greens, which is available on our website at changelabsolutions.org. Both profile a range of local, state, and federal funding resources that could be used to support healthy food retail projects, including healthy corner store initiatives. And here are just a couple of real-life examples of some publicity materials that past programs have used. Placards that store owners can post in their stores and on the storefronts to communicate their commitment to providing healthy options for local residents. On the left is a placard from the Hartford Food System program, and on the right is a placard from the Literacy for Environmental Justice Good Neighbor program, which is no longer running and has been actually assumed by the health department. These types of publicity strategies can be really effective and very low cost, and a great incentive for store owners. And they really can be an opportunity to enlist the help of additional community partners. We've seen publicity materials that have input from community members in terms of the look and feel, so that the materials really do speak to the local context. We also wanted to highlight one unique staffing model that reduces the need for paid staff and government oversight, which is the New York City Adopt a Bodega program. The program invites community groups to take food access into their own hands by adopting a bodega in their neighborhood and working directly with those store owners to improve healthy options. This helps extend the program's reach to more stores while empowering local residents to get involved in the process and to learn about food access in their communities. Program staff developed a toolkit that includes a sample script for approaching store owners, a store inventory form to assess current offerings, a store owner survey to understand barriers to selling healthy food, a list of healthy food options to choose from and making changes to food stocking, kits on developing and implementation plans, ideas for community activities, and design and layout suggestions, as well as templates for healthy marketing materials. Next, we're going to hear a little bit more about what the actual goals you might set with your store owners are.
So a program's success really depends largely on what its standards exactly are. In other words, what it requires of stores for certification. And I think one of the key things to keep in mind is that strong publicly disclosed standards ensure that store customers have healthier options available and that there's really transparency about what's going on in the program. But I think a key consideration is that a healthy food retailer program also needs to be feasible. For many store owners, it's not going to be realistic to go from where they are today to a store selling only the most healthy, locally sourced, humanely raised, many programs come up with extremely lofty visions about what they'd like their store to look like. And while I may share many of those values, overall I think for Healthy Corner Store certification programs, my recommendation would be to really view this as in a tiered approach and to start with a relatively small and achievable goal so that the stores can meet the criteria. And then to use the incentives to help the stores go further and further and further towards the full implementation of a truly healthy store environment. So our forthcoming toolkit will offer recommended standards for communities to modify according to customer and store owner input. And these standards are based on standards from programs we surveyed around the country, as well as our own insights into what a healthy store should look like. But generally speaking, store certification programs require both increasing healthy options, which is a place where many Healthy Corner Store programs start, but also decreased stocking of less healthy options. And that it varies how those terms are defined and what that looks like, but it's typically really those two combined. And then many programs also address how the store operates, including participation in nutrition education events, participation in federal food assistance programs, including SNAP and WIC, and some seek voluntary agreements to reduce alcohol and tobacco ads. We're going to hear more detail about how one community approached the standards from our second speaker, Sasha Belenki from Louisville. But I think it's important to keep in mind that since healthy food retailer certification programs are really voluntary, there needs to be a strong relationship between the standards that you develop and the package of benefits that inspire participation. They should really be matched to each other. And the benefits should really drive to reducing the cost of complying with the standards for store owners and also build their capacity to sell healthy foods in the long run. That said, and I think this is really important for those of you who are in the planning stages to think about, the incentives provided through your certification program should really be considered a short-term bridge from the retailer's existing business model to a healthier business model. So ideally, they really drive towards making a transition where the store owner completely carries the healthy options on their own. So when you put your package together, definitely seek input from the public and especially from the store owners. it may be appropriate in some communities to offer a set of incentives, a range that owners can choose from rather than a one-size-fits-all package. You may also offer the benefits in a tiered approach where you start small, and as the store owner gains momentum and confidence with offering healthy options, the rewards grow greater, so that the larger rewards are really reserved for those who are making very significant investments, ideally of their own resources as well, alongside your any financial incentives that you're offering. So in other words, that there's a matching requirement. So think about how you phase and time the standards. We're seeing here on the screen an example of how Kentucky approached that with specific dates where they offered incentives and benchmarks the store owner needed to meet in order to qualify for the incentives. And this is one example, a good one. I think there are others out there of this tiered approach with really regular benchmarks and check-ins with the store owner. So let's hear what this actually looks like on the ground. And we're really pleased to be joined by Sarah from Douglas County Health Department in Omaha, Nebraska, to hear more about how they approach this locally.
Thank you, Hannah. Again, we are so pleased to have Sarah on the line. She is coming from Omaha, Nebraska at the Douglas County Health Department. She serves as the Community Transformation Grant Program Manager as well as the Healthy Neighborhood Store Project Coordinator. And within the Community Transformation Grant Project, Sarah oversees the implementation of work plan activities across 4 primary objectives: smoke-free multi-unit housing, healthy eating, active living, and clinical care. For the Healthy Neighborhood Store Project, she's responsible for the management of all project activities, including identifying potential locations, recruiting stores, developing and implementing project materials, education and training, and sustainability strategies. Sarah is a registered dietitian who graduated from the University of Nebraska-Lincoln with a BS in dietetics and from the University of Central Oklahoma with an MS in nutrition. Thank you, Sarah, for joining us this morning.
No problem. I'm happy to be here.
So Sarah, could you just kind of start us off by describing how the Douglas County Healthy Neighborhood Stores program was created and why it was really needed in your community?
Sure. Our Healthy Neighborhood Store project actually began back in 2009 when the Health Department and then the Nebraska Department of Health and Human Services partnered to really look at the availability of healthy foods in Douglas County. And what we did is we performed or conducted a nutrition environment measures survey here in Omaha. And this assessment identified distinct pockets of our community where access to healthy foods was really limited. And the Healthy Neighborhood Store project was then created to provide resources and knowledge to store owners and community members within these nutritionally fragile areas to positively impact their health through increased availability of healthy food options. Our project was initially funded with CPPW funds, and when CPPW concluded in March, we were lucky enough to receive CTG funds as well. So CTG currently funds our Healthy Neighborhood Store project now. Throughout the creation of the program, we really have had a variety of stakeholders that have been involved in planning and implementing the project. Initially, the Nebraska Grocers Association was very instrumental in helping the health department to understand the world of grocery. They were really instrumental in helping us frame what this project would look like here in Omaha. They provided a sounding board for staff to vet potential processes or ideas. Some of our other stakeholders and partners included our local extension office through the University of Nebraska, and our partners at Extension provided in-store educations for customers and store owner trainings. And then we also have our 2 community organizations, which are the Empowerment Network and the University of Nebraska Medical Center, Center for Reducing Health Disparities, which really focused on community outreach and conducting focus groups, making sure that we were connected to the community. And then we also had a local marketing firm that helped provide us with all of the communication messages and promotional materials that we've implemented within the project.
Great. It sounds like you've enjoyed a lot of success in a relatively short period of time. I also just wanted to mention that Sarah actually sent us a video of her program, which is just really, it sheds a lot of light on the program. It's really fun and actually shows some of the nutrition educators at work. And we will be able to send that as part of a link after the webinar. So my next question for you is, how many stores do you currently work with? And could you kind of describe what these stores look like before your program and what some of the changes have been?
Sure. Right now we currently have 8 Healthy Neighborhood store locations throughout Douglas County. These stores generally service minority, predominantly African American and Hispanic individuals, and we're looking to expand the number of locations to 12 by 2014. But if you think of what these stores really looked like before the project started, if you think of just the outside of the store, which you can see here now, there's a lot of alcohol and tobacco signage up on the store windows. The signage would cover the windows and doors, and we've heard from focus groups over and over again that community members did not like, they didn't feel comfortable when they couldn't see into the store, or if they were in the store and they couldn't see out. It was really a safety issue for them. So we would have all that excess signage around alcohol and tobacco in the windows. Sometimes there would be the parking area wouldn't be very well kept up, or there'd be a lot of loitering on the outsides of the stores. Inside the stores before the project, in a lot of the stores we had a lot of lack of lighting, which kind of gave the perception of it being dark and dank, and focus groups told us that they felt that this was kind of dirty. The store felt dirty to them when there wasn't a lot of light in there. And maybe the display of the healthy foods weren't very optimal. So you could potentially have, like if they carried some produce, you may have an apple that just sits on a produce shelf. It doesn't look very attractive at all. And the stores, prior to us coming in, were very disjointed in their layout. So we actually had one store that carried a small amount of produce in their cooler. But then right next to that, they would have energy drinks and juice and all these other non-healthy items there. And it just was talking to store owners about really resetting coolers and let's bring all your healthy foods together in one section. So after we were in these stores, the outside, obviously, we provided some changes. We provided custom-made promotional materials for exterior signage. We worked with store owners on taking down as much of the alcohol and tobacco ads as they can. However, some of them do have contracts with alcohol and tobacco companies, so some of that is guided by those contracts that they have. So we tried to work with them to take down as much as they can. And we worked at helping them. We had another part of our Communities Putting Prevention to Work grant that looked at increasing opportunities for physical activity within businesses. And so we were able to provide bike racks outside of our Healthy Neighborhood stores. So those were some of the changes that you would see after the program was implemented outside the store. And then inside the store, we had a ton of promotional materials, signage, point of purchase prompts. We would help them display the healthier foods in a more attractive way with things like the clings that you're looking at now for the produce containers. We did produce baskets, which we really talked to store owners about keeping things clean, bright and airy, so that people really were attracted to the healthy foods that were in the store.
Great, and those are some wonderful before and after photos from working with the store owners. So along those lines, clearly you worked very closely with these stores. So could you describe a little bit of your process for assessing and selecting stores, and in particular, what were some of the criteria for working with store owners and assessing their readiness for these types of changes?
We wanted to be very purposeful in how we selected these stores. So initially what we did here at the health department was we created a series of maps, and we used a variety of different health indicators, so fruit and vegetable intake, obesity rates, death rates from cardiovascular disease and diabetes, population density and income, And then our food access data from our NIMS assessment to help us identify areas for project implementation. And through this multi-phased mapping process, very distinct areas emerged for having the greatest risk. And the resulting map identified areas where the greatest impact for change could be felt, and also where access to food, healthy food, was limited. Along with that map, then they also showed us locations that already had existing capacity to increase their nutritional profile by increasing the amount of healthy foods that they carried. So once we kind of had these focus areas identified and the stores that were within those areas, I would go out and talk to store owners, and we had them initially complete a store owner survey, which was really more of a guided dialogue. And we got at things about how did that owner perceive the store's role within the community, and what was their willingness or readiness to make changes within their stores. So stores that felt that they really did have a role in supporting the community and expressed a willingness to begin to start making some changes in their store, i.e., promoting healthy foods, things like that, and had that existing capacity. They had that NIMS score of a 3 or a 4, which just basically said that they had adequate availability to 3 or 4 of the 5 food groups that we looked at. And if they really showed a desire to be part of the project, those were the stores that we selected.
Great, and that's a wonderful message. So kind of continuing along with this store owner relationship, so something that is pretty unique about your program is that you actually don't use a single set of criteria or nutritional standards that store owners need to aspire to. So could you kind of describe, once you sort of formalize that relationship with a store that's enrolling in the program, how you approach goal setting with the store owners?
Sure. Once an owner has committed to becoming a healthy neighborhood store location, I would actually come in and conduct another NIMS assessment. And we did this basically because NIMS is a point-in-time assessment, and we felt like it was really important for the health department and for the store to really know where they were starting at pre-project. Once I completed that assessment again, I would create a NIMS outcome and store recommendation report for each store. And this report really outlined the NIMS findings, and it included potential modifications that each store could do that were specific to that store. And these potential modifications were classified in one of 3 ways. So we looked at either increasing healthy food options, modification to store design or layout of healthy foods, and then nutrition education or training opportunities. And each store owner and I would go over all of this information and these ideas, and we would have this dialogue about what did they think would potentially work at their store. We emphasized that the store worked within their existing business model so that they could maximize their resources and really improve their nutrition profile. And we did this by, like you said, identifying goals. And we not only identified what goals did they want to meet as a healthy neighborhood store, but what were those methods? How were they going to achieve those goals? And what resources did they need to be successful? And these goals and methods for achievement and resources would all be then documented as part of their healthy neighborhood store proposal. And this proposal really was sort of a contract of sorts that really identified what the store would be willing to do as part of the project. And it really was very owner-driven. We could bring ideas and suggestions, but that conversation about what do they want to see happening in their store was very important, because the more they felt like they were driving the discussion and the changes in their store, we really saw that the more likely they were to be to sustain those changes. Great.
It's wonderful to hear that sustainability is really built into this model and store owner buy-in. And just to kind of ask a follow-up question, we've seen your templates and your model contract and everything, and can we possibly make those available for people if they are interested in seeing examples from your program?
Sure, that would be fine.
Great. So we're actually going to switch gears. We're going to be hearing again from Sarah at the end of the webinar during the Q&A. So we encourage those of you who are participating in our webinar to send your questions using the chat function. Thank you again, Sarah, for sharing about your program.
Thank you.
Great. So I wanted to focus for a moment on the implementation, enforcement, and sustainability of your program. And that might seem a little odd since many of you are in the very early stages of setting up a certification program and still thinking about whether it even makes sense. But I think it's so important to think about how you keep the program going really right from the beginning. And it's just I have been working with Healthy Corner Store projects for over a decade now, and so often I meet naysayers who argue that these sorts of programs can't be sustained over time. And I think there is an unfortunate truth, a partial truth to that statement, that many early Healthy Corner Store projects were difficult to sustain over time. And I think that we can really learn now that that people have been working with small owners, store owners in this way for 10 or 15 years or more, we can really learn from projects that haven't been able to sustain the changes and incorporate those lessons learned into our program design. So what do I mean? I'm going to talk about 4 key tips for program implementation and sustainability. And I'd like to really start with the initial commitment and agreement that is made between the advocate of healthy store changes, whether that's the local government entity or a community-based organization, and the store owner. So those two entities need to come to an agreement about what exactly is going to happen in the store. And the goal with that agreement is really to build a long-term relationship with the store. The agreement needs to include the time frame during which the store will make the changes to meet the certification requirements. And I think that establishing a time frame provides some coverage for both entities. The store owner knows that they're not committing to doing this forever and ever and ever and ever and ever. And you too, as the advocate for these kinds of changes, know that you're entering into a trial period where everyone's going to give it their all during that delineated period. Maybe it's, for example, 3 months. And then it can be reevaluated and perhaps lengthened. And obviously, over time, you want it to be carried forward indefinitely. But I would encourage you to start out with a shorter time frame, and really outline the standards, what exactly is the store owner going to do, and then the benefits. What are you offering the store owner in exchange for performing to those standards? And again, harkening back to the earlier conversation, really encourage you to think about standards in a tiered approach, that you're not going for maybe not for every single bell and whistle that you want early on, but you're starting very small to let the store owner experience some early successes. And then you think about, well, what happens, and you can outline this in your agreement as well, what happens if the store owner decides not to continue with the changes? What is the recourse going to be? What are you going to do? So it might sound intimidating to approach the store owner with a contract. I would just say that the contractual aspect of the program really ensures that you, as the sponsor, have laid out in advance what's going to happen if the store doesn't continue to meet the program standards. And this could include if you're offering incentives, that those are revocable. It could include that you're offering technical assistance or support. There are lots and lots of different ways that you can remedy noncompliance, but you want to spell that out up front so that everyone is clear and the expectations are clear for everyone. And we have in the toolkit that's forthcoming this fall, for which again you'll receive an email, you don't need to take any further action, includes a model agreement for healthy small food retailer certification programs that gives you all the options to fill in the blanks with your specific requirements and benefits, and puts that together in a way that you can use with your store owners. So I would say we've reviewed lots and lots of these kinds of contracts around the country. Sometimes they're called MOUs. And the successful agreements clearly establish accountability. There's usually a one-to-one agreement between two individuals or two entities, the business and the organization, so for who's doing what. It ensures that the store owner is making a commitment of his or her own resources. It's not only receiving benefits, that they are committing to making changes or maybe even ultimately investments in those changes. As I said, it establishes a timeline and delineates what happens if the terms aren't met. So how do you monitor this agreement once you have it in place? And I think the words monitoring and enforcement can be intimidating to people. Really, this is where you get the chance to go into the store and provide the support to the store owner. And that can happen by the program coordinator periodically visiting the stores. And I would say most existing programs do periodic inspections to monitor compliance. You could have stores have an annual renewal process to continue to receive the benefits of certification. That can ensure that the stores continue to apply. It can take into consideration any changes in store ownership or management, and allows you to investigate, is the store in the right tier, or could they be doing even more in a higher tier than they're currently operating in? So how do you carry out this monitoring? A few recommendations. Certainly, in many instances, it is the Healthy Corner Store Certification Program Coordinator who conducts these visits. But I would encourage you to look at what the existing resources in your community are. Are there any existing regularly scheduled enforcement visits, for example, around public health or public safety? Could you coordinate with them to describe the agreement that the store has made to these healthy options, and can these other local government representatives play a role in supporting your program? And I would say, as a final thought on that, really I would encourage your approach to be enforcement to think about it as a collaborative relationship, and that stores that aren't able to carry through on what they had agreed to initially are really eligible for more support, more technical assistance to reevaluate and perhaps redefine the goals, and to really drill down to understanding their barriers, which often are many and very, very legitimate. So the other component that I think is really critical to think about is your evaluation. And I know that can be overwhelming to plan for, but I really want to beat that drum because it is so critical to understanding what works and giving access to that information to share with other programs around the country. And really, even if a formal evaluation isn't within your purview, informal evaluation like surveys or interviews can really help give you information to improve your program, and then demonstrate viability to retailers who may be interested in participating, and then obviously to other communities as well who are really interested in this approach. I think evaluation allows you to identify what works to increase sales and what doesn't work, and that should, ultimately that's the success, right? You want these healthy items to be a sustainable business model for your store owners. So program evaluation should examine whether your program actually changes what people purchase, how it affects sales, and whether the overall product mix changes as a result of the program. I wanted to make sure that everyone on the call was aware. I would imagine many of you are, but Joel Gittleson, who's been a real pioneer in the Healthy Corner Store research and evaluation fields, published a literature review on program impacts in just earlier this year in preventing chronic diseases. And I would encourage all of you to track that article down and read it. It has it's a wealth of information, including both peer-reviewed literature and self-published evaluations of corner store programs. There's really a lot to learn there. So finally, I would say that Healthy Corner Store certification programs are an excellent tool for building store owner relationships and community and excitement. But, and I want to be upfront about this, they are resource intensive to maintain indefinitely. So that's another thing to consider. are you going to be able to support this over the long term? And I would suggest that you consider, in your bigger overall community strategy, to really focus on strategies for built-in funding, for example, by bringing your economic development agency or redevelopment agency to the table early on, looking at zoning incentives, looking at licensing, and other policy requirements that can really institutionalize these kinds of changes and don't require long-term grant funding. And then finally, of course, structuring your program so that the store owners carry it on themselves over time. So with that, I'd like to hear more about how a Healthy Corner Store certification program looks on the ground from Sasha Belenki, who is with the YMCA of Greater Louisville, Kentucky. Sasha, thank you so much for joining us on the call today. And just to orient people to the work that you've been involved with, could you give us an overview of how your program works and the history of how it was created and why it was created?
Sure, and thank you so much for having me. Our program is the Healthy in a Hurry Corner Store Initiative. We're based out of Louisville, Kentucky. And our program started in 2009 with funding from a grant called Pioneering Healthy Communities from YUSA. We started with 2 stores, actually, one of which ended up not working out. It was a great lesson learned for us. And so just as a word of encouragement, our program is doing very well now, but we did begin with a store that didn't work out so well. The name Healthy in a Hurry was actually thought of by a 7th grade girl in an adjoining middle school at our first store, the Dollar Plus. And we had a little focus group to think about what we would call the program, and she actually came up with the name, and it stuck, making us the Healthy in a Hurry Corner Store Initiative. Since the success of our first store, the Dollar Plus, we have opened 7 more stores with funding from communities putting prevention to work. The way that our corner store program works is that we allocate about $15,000 per store to go in and do the intervention, or as I've actually recently heard at a conference, the corner store upgrade, which is a term that I like much more. We work on signage, marketing, equipment purchases, technical training, any technical assistance that the store needs. We help with the first several orders of produce. We do community outreach, and we really try to connect that store owner with the store. And we currently have 7 operating stores within our program.
I love that the name came from a 7th grader. That's really great.
Yes, we actually had a marketing group that we had help us, and all the names they came up with were completely shot down by the kids, but this one rose up and really stuck.
That's great. So tell us some more about what your process has been and your main criteria are for assessing and selecting stores to participate in the program. I know that's a source of concern and consideration for many who are in the early planning stages. How do you know who a good candidate is, and what can you ask of them that they can actually achieve?
Sure. I would say that our partners have been immensely helpful in identifying the stores that we have worked with. Our main partnerships are with the University of Louisville School of Public Health, our Center for Health Equity, which is a department of our Department of Public Health and Wellness, and also working with local neighborhood groups. So those 3 resources, those 3 partnerships have been absolutely crucial to choosing the stores. Our assessment process usually begins with an assessment by students from the School of Public Health, and they do this as a part of their spring semester project for the first year evaluation class, and we work very closely with the professor who teaches that class. She actually also did evaluation work on our local CPPW grant, so that was a great connection. And they do sort of a first evaluation of all the stores that we have identified as potential candidates for this year. They will identify several stores based off of their evaluation, and we will then, from a programmatic standpoint, approach those stores to discuss in more detail what their involvement in the program would look like. And at this point, we sort of start to develop the relationship, from my point, from the project manager and the store owner. We do a series of surveying before we invest any money in the store. We do about 100 surveys, 50 within the store, 50 around the community. And if everything checks out fine, if we find that the store owner has the capacity to take part in this, has the desire and the resources to be successful in this, then we present the store owner with an agreement, as we discussed. And that agreement also outlines all of the expectations that we have for participating in the program.
That's great. I was really interested in the information that I showed the chart for earlier about how you offer different incentives at different stages of the work. So, digging into the issues of implementation and long-term sustainability, could you describe your approach to working with the store owners while the healthy changes are being implemented?
Sure. Of course, I think at the very baseline there is that aspect of relationship building, and that, we've included the store owners in all sorts of community outreach efforts, whether it's taking them along to a community meeting or involving them in a neighborhood association meeting, or encouraging them to be part of a local business association. So there is that element of relationship building. Now, what you were talking about is the actual graph that shows the incentives, and that's another thing that we try to do to keep the store owner on track, especially within the first 6 months, which is such a crucial period to the success of the program, to make sure that they are consistently keeping up with the quality of the produce, that they are tracking their sales so that we can accurately report for our own needs, evaluation needs, and our grant reporting needs, and just making sure that they are keeping up with the program in that very critical period when they are developing new relationships with their own customers.
Yeah, that early stage is really tender. What about how intensive is your monitoring process during and after the changes have been made? I mean, we're seeing some really inspiring images of the changes. How are you making sure that these changes are sustained over time?
I, as the project manager, conduct site visits. When the store first opens, it's on a twice-a-week basis, sometimes a weekly basis, and I'm just coming in, checking on the store owner, checking on the staff, seeing what they need. As far as more formal evaluation goes, I mentioned that we do a series of pre-surveying before we make any sort of investments in the store. We also do, we actually are working on right now, post-surveys about a year out for most of our stores to see the kind of changes that have been made, what more can we do, whether healthy eating has actually been improved. And then on a more consistent basis, we track sales results, and we have the store owners report their sales results on a monthly basis to us to see how they're doing, if they're profiting, if we need to adjust, what they're purchasing, if we need to adjust how much they're purchasing or how often they're purchasing. So those sales numbers really help us evaluate what minor changes we need to make sure that they are sustainable, as far as their business goes.
Well, that's really great that you're able to collect that kind of data.
It's not always easy with every single store. I mean, there are some stores that have more the capacity to give us that data, and there are others that really struggle with reporting that. So.
Yeah, I think even just having the infrastructure to know what they're selling, I think it's very common for store owners to literally not have that information because of using really old cash registers. So they're using proxies or their own sort of intuition about what's selling. And I've definitely seen some store owners really have their eyes open to how much shelf space, for example, they're offering to products that simply don't move. I mean, I think we've all walked into into stores where the products on the shelf have a thick layer of dust because they haven't literally not moved since the store owner put them there in the first place. And I think the kind of data that you're accessing can be so valuable to show them not only what is moving, but also what isn't moving and what maybe could go off the shelf to create some space for more healthier options.
Sure, and Sarah's evaluation process was so great because I have to say that every store is very different. I mean, we have had stores where we've actually hired a cash register programmer and trainer to come in and work for an hour or two with the store owner to reprogram that cash register and make a button that is specific to fruits and vegetables so that we can track those sales.
Yeah. Yeah. How are you thinking about the issue of sustainability in terms of ensuring that the healthy changes continue after the project? After the funding goes away, what strategies are you employing now to make sure that the changes sustain themselves?
Sustainability has always been really important to us, and it really begins with day one. Sustainability we're working on, I would say, on two different levels. There is the community sustainability, which I think is actually the most important, and that is doing that community outreach from the very beginning, making sure that you build those relationships between the store owner and his and her community to make sure that they feel ownership over the process and that they hold the store owner accountable when our grant funding ends and it's time for us to step away. Like you said, we can't be there forever holding that store owner's hand. We have to make sure that the community steps up and values this work and wants it to continue. On that level, we work with business associations, we work with neighborhood associations. Those have been some of our best partnerships, neighborhood associations that continue to check up on the store owner, commit to buying from his or her store, so long as he maintains the program. We have also recently started a Healthy Corner Store Business Association that is beginning with our own Healthy in a Hurry corner store owners, and we hope to expand it to other corner store owners that are interested in learning about ways to make their store healthier, whether it be taking down negative advertisements such as those alcohol and tobacco, moving more healthy items to the point of purchase, whether if they're interested in starting to sell produce for the first time. We want those store owners to see each other as a resource and build up that business association.
I love that idea. I've actually never heard of that particular strategy before. How do they meet or communicate with each other, the members of the Healthy Corner Store Business Association?
We actually just started meeting back in March, and for the first several months we were meeting on a monthly basis, and I was leading those meetings, but we will, from here on out, we're meeting on more of a quarterly basis. We're still sort of trying to gain momentum as we develop actual incentives for being a part of this program, as this is an unfunded opportunity. But we're hoping that just our power in numbers will create incentives for other store owners to join. Talking about decreased collective buying, or even things for the greater good of their business, such as insurance rates, going in for those sorts of things together. So really, how do they make their overall business stronger so that they can support selling these healthy items and being a healthier store?
That's really, really great. I look forward to learning more about how that goes for you. I certainly know that that for many store owners, hearing from others is one of the most powerful ways of disseminating best practices and really inspiring change. So kudos to you for putting that together. We've had a couple of questions come in from the audience that we'd like to give our presenters a chance to answer now. And anyone who hasn't yet asked a question, just a reminder that you can enter it in the chat box on the lower left-hand side of your screen.
Great. So the first question that we wanted to ask, we've had a number of people kind of curious about what the actual nutrition standards are that you're using. And I know we aren't really getting into some of those types of details in the program, but if each of you could just kind of describe how you decided what is considered healthy and unhealthy for the store owners and kind of the process of determining that. Maybe we could hear from Sarah first.
Sure. This sort of guidelines or standards that we used was based on the NIMS tool that Emory University actually came out and helped us modify the original NIMS assessment tool to one that was more specific towards Nebraska in general. And when we looked at the 5 foods that we looked at were fruits and vegetables, fresh, frozen, and canned, and then whole grains, lean meats, and low-fat dairy. So the actual, guidelines on that, I could send those out to everyone on the webinar, but it's very specific, and so many grams of fiber, and based on that would be what the score would be for the stores. So we have that available, but it's a long, like 6-page document of how Emory shook all that out for all of those 5 food groups. So I can be more than happy to get it.
Great, thank you. And Sasha?
Well, we actually only include fruits and vegetables as a part of our program, which makes those standards a little bit easier because we only help with the purchase of fresh fruits and vegetables. Now, we will encourage the store owner to include more canned items, more frozen items within his or her store, but we don't. We are not directly involved in that.
Sure. So we will make the NEMS link available for people afterwards. Great. So the next question is, we had a speaker or a participant who was interested in hearing more about the impact of tobacco and alcohol contracts, which can prevent the removal of posters and marketing materials in stores, and it's been mentioned a couple times on this webinar. So is this a challenge that either of you really dealt with head-on, and kind of how did you get around this challenge, particularly using incentives or just finding other workarounds in order to make it less appealing for store owners to have those sorts of materials and advertisements?
I can start with that. We actually, in our agreement with the store owner, we asked that one of the items that we asked for is that the store owner reduce the amount of alcohol and tobacco signage within his or her store. And of course that is different for every single store. It's hard to put a percentage or a number on that because each store is different. Some stores have windows, some don't. Some stores have different amounts of square footage. But we've found that as long as we are reasonable and we sit down with the store owner to discuss what they can do, there's usually some sort of compromise that we can reach. Another thing that we like to do is replace every bit of negative signage we take down with some positive signage, and so that sign is being replaced with something. We have a social marketing campaign here that was also done by the YMCA called the Food Fight Campaign. We have a series of posters, and we've replaced a lot of alcohol and tobacco signs with those Food Fight posters. So, I mean, we found that the contracts haven't been that much of an issue, but of course, I have always left that up to the store owner. They do have a business to run, and I would never want to create any sort of conflict between them and their existing vendors.
I completely agree with Sasha. It's really about each individual store's contract. We found the majority of our stores do have tobacco contracts in place, and there is some stipulation on the amount of signage, but we found not a lot of stipulation on the placement of signage. So talking to store owners about would they be willing to maybe take down the tobacco ad that's in the door that takes up the whole door and maybe move it towards the back of the store, and then, like Sasha said, and then put up a nice Healthy Neighborhood Store, sign or promotion where we've removed that tobacco or alcohol ad as kind of the strategy that we used.
Great. It sounds like you've both been really able to work with your store owners and think about creative solutions. And another sort of thing to think about is kind of the longer-term strategy. Since these contracts are up for renewal periodically, it sounds like that may be another point of discussion with the store owner as time goes on. So we had another question about the evaluation component, and someone on the call was wondering if either of you could discuss some of the findings that you're getting from your data so far on whether community members actually purchase more fresh food over time, and just the overall impact of these programs.
Well, here in Omaha, we have each store will monthly fill out a inventory tracking tool for us. Since we do, the size of the stores that we deal with are, there's a wider range of them. So not all of them have the ability to specifically track sales. So we look at their inventory records. So we look specifically at fresh fruits and vegetables, so like apples, oranges, bananas, broccoli, carrots, and cauliflower. And then we look at what they're purchasing from their distributors and looking at that change then over time. We also look at skim and 1% milk purchases from their distributor, and then whole grain breads purchases from their distributors. And what we've seen is so far 75% of our stores have noted an overall increase in total sales. And then improvements in sales of whole grain products, low-fat milk options were noted in 88% of our stores. So store owners are really telling us they feel like this project has really helped facilitating a positive change in their store. But we don't really necessarily have a formal evaluation that is of the project that gets really in-depth into actual sales per se. It is more of what they are purchasing from their distributor. That's the only mechanism that we were able to find that all of the stores across the board could handle.
That's really great, Sarah. And have you heard, perhaps at least anecdotally, about whether or not store owners are experiencing an overall increase in sales or profits, or whether or not there's been any change there?
Yes, we have heard from store owners. Certain examples. One was we had a store owner that was talking to us about how, he was only purchasing about a case of bananas a month was all they would go through. But, he knows now that they're going through, almost a case a week of bananas. And so, he feels this is great. He's selling these healthier foods. And the interesting part is he's actually lost 17 pounds since since the program has started at his store, because he just keeps talking about how important it is, to provide all these healthy foods for the residents in the community around his store, and how he needs to put that back on himself and try to eat healthier and be more conscious of health. So
that's a really inspiring story. Sasha, did you want to share anything from your evaluation results so far?
Well, we are tracking sales within our stores. Like I said, not all of our stores are able to report those, but we do have 5 out of our 7 stores that give us exact sales numbers each month. I do know that all of our stores are breaking even at the very least, with the 5 that we actually do get sales figures from are significantly profiting. And again, we do have the post-survey that we're currently working on that is a bit more of a qualitative look at whether or not people are actually eating more fruits and vegetables in the neighborhoods where our healthy corner store interventions have taken place.
Great. So we have one participant on the call who it sounds like she or he is in the assessment process, and they have found that their preliminary survey results with local stores and community members have indicated that the store owner believes that there's no interest in people purchasing fresh fruits and vegetables from convenience stores. So do you have any tips for how you've worked with messaging or perhaps with store owners who kind of have that ingrained stigma or idea that customers don't want healthy foods?
Well, here in Omaha, we really worked hard to reframe the messages that we heard from the community within our focus groups, and to really be able to talk to store owners and say, these are the people that live around your store, and this is what they are saying. And in the end, it is a business, and they do want to make a profit. And you do have store owners that kind of have that of, this isn't going to work. Well, what we found is that the store owner that feels that way, and it says that from the beginning, probably isn't going to be the store that is ultimately going to be successful. The store owner that says, I get this, I want to help the community, I see the benefit in this, is the store that we found has been very successful.
Yeah, I'd have to agree with that 100%. I mean, it's so important to just choose the right store owner from the onset, and you have to have someone that is going into this with the right intentions. And from my experience, that's always been someone that has a good balance of wanting to play a bigger role in their community, help to create a healthier community, but also someone that sees this as a valuable asset to their business. Because that's really how you keep it sustainable, is when you have that store owner that's really invested in this working out. And I always tell store owners that a lot of store owners have concerns about putting fruits and vegetables into their stores, with spoilage and with all the extra work that goes into ordering and keeping up with the inventory. And I tell them that yes, it has a shorter shelf life. It's not going to last as long as your potato chips and your soda. But if you get customers buying produce in your store, they'll be coming into your store more often, and that is immensely valuable because they'll be buying other things as well. So yes, these items have a shorter shelf life, but that's also a good thing in so many ways.
Great. And we only have a couple minutes left, and so I was hoping that maybe you could just each describe kind of your key takeaways or lessons learned, and kind of also kind of what if anything came up during the process that you were really surprised by in terms of challenges and how you got around those.
This is Sarah. I can go ahead and start. As far as lessons learned goes, I think adequate planning and mapping of our community's current landscape when it comes to food access was very instrumental in making sure we were choosing appropriate locations. And then with providing store owners, having a very open line of communication with store owners and providing them with our potential for impact map and our focus group and survey results and training for them, it really created a really strong alliance between the project and the stores. And I ultimately think store owner and neighborhood engagement is fundamental to sustaining any sustainable change. So, that's kind of what we're striving for daily. And then as far as kind of, aha moments or, things that kind of took me by surprise were the challenges that I had getting into the door sometimes when I started with, my name is Sarah and I'm from the Douglas County Health Department. These are smaller stores. They do have kind of a network, even if it's informal, of they know that store owner and this store owner knows that store owner. And when you come in and lead with the health department, they automatically think regulatory enforcement of rules, regulations, policies. And we really had to rely very heavily on our community partners to help overcome this initial perceived barrier. And then once you get past that and you create that solid connection between the project and the store owner, that goes away. But I was really surprised at initially how much we relied on those community outreach organizations to really help us get the conversation started.
Yeah, again, I agree with all of that. The community outreach is absolutely essential. I would say that the greatest lesson that I have learned in all of this work is that the hardest stores to work with are often in the communities with the greatest need. And I had to keep reminding myself of that on several occasions, that there's a reason it's tough to work with the stores, because the community really needs it.
Great. Well, thank you both so much for sharing your experiences. I think that everyone on the call is probably just so inspired by the work that you've been able to accomplish, and hopefully they've seen some pearls of wisdom and ideas that they can bring home to their own communities. So just to close off the webinar, we wanted to highlight a couple of resources that are available on our website. We had mentioned the idea of a licensing scheme for healthy food retailers, and we have a model ordinance which is available. And there's also a toolkit on kind of the incentive piece of working with small stores. And you can download both of these on changelabsolutions.org. We had also mentioned the importance of really finding resources to sustain this work in the long run. And here are the two guides that we highlighted. And they are the one on the right, Green for Greens, is also available on our website. And finally, we wanted to highlight the Healthy Corner Stores Network. This is a great resource for people who are at all stages of this work. There are examples from the programs that we've profiled today, as well as many others. You can find information about the programs, example store materials, and so on and so forth, as well as links to different types of guides and other materials. And thank you again to our sponsors, the Healthy Network for a Healthy California, and we look forward to seeing you on future programs. Please feel free to contact us if any questions come up. Thank you.